back with another episode of Local Roots. Hi, I'm Todd. Coming up today, yesterday there was a proclamation from the Pottawattamie County Board of Supervisors, and it has to do with radon and taking action regarding it. I didn't know a lot about it until I had this conversation with Candy Steenblock. Candy is the epidemiologist with the Pottawattamie County Public Health Department, and she tells us more about what radon is, how it can seriously affect your health, and what you can do about it. So the County Board of Supervisors are encouraging everyone to have their residents and place of business tested, and that is coming up, that conversation coming up today. Candy Steenblock, county epidemiologist with the Public Health Department, our guest today on Local Roots. Local Roots brought to you by Dave Lawrence, your Edward Jones financial advisor. Learn how he can help you reach your financial goals. Visit edwardjones.com for more. Edward Jones, member SIPC. Castle & Associates of American Family Insurance, your local insurance provider for all of your home, auto, life, business, and farm insurance needs, with 4 convenient locations. They're in Trainer, they're in Council Bluffs, also Bellevue and Elkhorn on the Nebraska side. They are local, and they're in your neighborhood, ready to help you navigate the complexities of insurance today. Travis and his team will educate, advise, and simplify insurance, all to protect those things you cherish most. Give them a call for your free quote. And be sure to start your day right at Brewed Awakening in Avoca. Open Monday through Saturday, always serving something fresh like bagels every day. How about that? Weekly specials that you're not going to find on the menu, and warm seasonal soups every Tuesday and Wednesday. And Wednesdays and Thursdays, grab a hot breakfast sandwich. Treat yourself to something sweet every Friday. Stop in for great coffee, good food, and a friendly hometown atmosphere at Brewed Awakening in Avoca. We're welcoming Candy Steenblock into the studios on Willow, and she is the epidemiologist for Pottawattamie County Health. And thank you so much for your time. Grateful that you were to come in.
Of course.
I'm trying to... You're not related to a Steenblock from Northwest Iowa, are you? We had one that was a third-grade teacher in my tiny little school that I went to.
I don't believe so.
No.
Nope.
Okay.
It's my married name. So.
Oh, it's your married name. Okay. Well, that's perfect. But again, thank you for coming in today, because we wanted to learn a little bit more about what you do. And also, you're here to talk about a proclamation that the Board of Supervisors just signed and put out there. So we'll talk about that too. But epidemiologist is a big, long word.
Yep.
What does that mean?
It means the study of diseases. So essentially the study of epidemics. So if you think of course, COVID, or if you think of in general some of those more common illnesses that you might hear of. I look into a lot of outbreaks for influenza, RSV, but more reportable diseases as well. So Salmonella, E. coli, we get reports of those for individuals that live in our county, and then we investigate them. So essentially we try and find what the cause is and make sure it's not something that needs a recall. So it's really looking for sources of illness, whether that's person-to-person illness, foodborne, waterborne, vector-borne, like a mosquito-borne illness, and seeing what steps, if any, public health needs to take to reduce the amount of people getting it. So say pertussis or whooping cough, if we have a case of those in the county, we look into it and see if household members have similar symptoms, and if not, they can receive something called post-exposure prophylaxis, which is an antibiotic, and it should prevent them from getting whooping cough when they are exposed to a household member, and if it doesn't prevent it, it should lessen its effect. So pretty much I connect all those dots, try and find the source, stop the spread, all those fun things.
So you would have then probably hospitals, other health organizations that have you on speed dial if anything comes up, because
Yep.
Is it a requirement that they notify you? Is that how the process works?
So the Iowa Code has a list of approximately 75 reportable diseases. They range from allowing a hospital or provider like a week to report it, but more important things are immediate reportable. So if we're talking anthrax, measles, some of the more severe they're going to have a higher consequence to individuals. Those are immediately reportable. So the provider or the hospital's infection preventionist pretty much should hop on the phone immediately and call the state's health department. It's the Center for Acute Disease Epidemiology, CADE. is the short name you might hear here and there, but they pretty much are the state's bureau of what I do. They will talk them through what to do for those high consequential diseases in the short term. They gather the info, and then I would look more into the nitty gritty details when it's appropriate to do so. So, say you have someone in with measles in the hospital, the state's going to help them at that moment, but then I'm going to do the legwork of finding out where they've been, who they've exposed, who may need post-exposure prophylaxis, and ensuring or strongly encouraging that those individuals get it, quarantining people if necessary. So there's just a lot of disease investigation that goes into what things I do, but it is required for about 75 different diseases.
So in a case like that, though, it sounds what you're saying is that your office is actually responsible for making some of those notifications. Or are you anticipating somebody who has been exposed and already might be a patient? You're not putting
So
it on them?
like when the lab gets a positive result,
Mhm.
it's either electronically reportable automatically to the state, and then the state will funnel it down to the county of residence for the person who tested positive for that disease. So it more or less is the code calls out the provider or essentially the lab, whoever gets the positive result on that. Someone in their entity is responsible for reporting that to the state. There are times that we get the call instead, and they didn't go through the normal process of an official report. So we have a disease reporting card that if we can gather enough information or if it's too convoluted, we instruct them the correct way to get it reported. So we do make some of the reports if it's necessary. Otherwise, we instruct the facility to really kind of go through the correct channel to do so.
Are you also, and again, I'm just guessing here because I know nothing about this particular part of the world, that say neighboring counties would you'd be in contact with each other a lot, say, hey, we have this going on, you may want to be aware that the
Yes.
possibility is it's just in your proximity.
Yes, that sometimes comes up because some of our more rural towns in Pottawattamie County will actually go to a provider that is outside of our county. So
Okay.
a lot of times I've gotten results and they were actually seen at either Cass Health or Merchu Medical Center out there, more east side of the county area. That's where those individuals sometimes will go seek care. So then we don't have as direct relationships as we do with our hospitals.
Mhm.
So it takes a little bit more digging, but then we work with the neighboring counties a lot, whether it's a transfer, because they'll get that report, but then they see they live here. So it's
How does someone get into this field? This seems like a little bit of a different type of thing to say, hey, I want to be an epidemiologist.
so, funny enough, I actually started as a temporary employee with the county during COVID for
Hmm.
the disease contact tracing.
And it just kind of grew from there.
I must have done pretty good because Matt and Maria, when the opportunity came
Yeah.
up, I interviewed and it just kind of worked out that.
And it's obviously you're getting some type of satisfaction from this. It's feeding you that you're doing it because I can tell you that you like this kind of stuff.
Yeah, I
Yeah.
enjoy it and it's satisfying to kind of like dig through, figure things out. And honestly, you help people because um, some people just you don't always get say you go the ER
Hmm.
or the ED now, um, they don't always follow up back with you. So you might have tested positive for something and they don't let you know. And then I'm that contact. So I ease their worries, get them the treatment maybe they need, make sure they follow up with their doctor.
Well, you were at, as we're recording this on this day, you were at a Board of Supervisors meeting, and it's something that you brought here with you well, go ahead and tell us what this is, and then we'll talk about the why behind it.
So I went ahead and just brought a copy of the Radon Action Month proclamation. So essentially, this is one of the more formal documents that the board puts forward. Excuse me. Get in a tickle.
No, you're okay.
I don't talk this much lately. I've been on maternity leave. I don't talk to a baby sometimes. So essentially, this is a more formal document that acknowledges um, something that the board wants to bring awareness to, or for this, it's encouraging action. So with Radon Action Month, we're basically acknowledging that radon is an issue in Iowa, not excluding Pottawattamie County. So you can expect that like 7 out of 10 homes in Iowa are going to test above EPA's level.
Wow.
So it's a substantial amount. And in some cases, it's more than double their safe level.
Mm-hmm.
No amount of radon is safe, but that's their actionable level. And it's a leading cause of cancer for non-smokers. So if you know anyone who's ever had cancer and they never smoked in their life, it's suspect that it could be from radon.
All right, let me do what I do, which is connect dots that may or may not exist.
Mm-hmm.
Now, I know that a study was recently put out that showed that Iowa was one of the top, if not the top states for cancer in the
Yes.
United States. And people will then draw their own conclusions as to the why behind it. But from what you're saying, this could actually be one of the contributing causes to that.
Definitely a contributing factor, especially for lung cancer. But I know that other factors in our area, alcohol consumption, lifestyle, but radon for sure.
Radon for sure. So, is cancer the main worry from exposure to radon?
Lung damage that usually will lead to cancer. It's radioactive gas.
It's radioactive gas, and if I remember right, if I'm flashing back to school, and that was like about a year and a half ago, that it's odorless, right? This isn't something that a person can detect on their own.
Odorless and colorless. Tastes like the only way to know that if it's in your home or dwelling is through a test.
So what do you do? Then what is the process?
The good news is that we have easy, accessible, inexpensive tests that we sell from the planning department or the public health department.
Mhm.
They're $11. That's at cost, and it's cash or check, and they're super easy. It's essentially a foldable with a prepaid stamp and everything. I believe it's carbon is the way that it absorbs radon out of the air, and then it's sent to a lab and they analyze. It's measured in PCI by liter.
Mhm.
4 is the action level. In Iowa, you can expect like 8+ PCI per liter. So the safety level that they set applies to an average across the whole country. Iowa, unfortunately, like the whole reason for this proclamation, has that exceedingly high dangerous level. So pretty much you can expect to have a high level if you live in Iowa. The next steps are getting connected with a licensed mitigator. So that's really the action that you can take for yourself. So we were just talking this morning at the board. We're going to look into some ways. Say you live in an apartment and you find out you have high radon. There's not necessarily a law that your landlord has to mitigate it. So just kind of looking into some of those things, because first step is knowing that you have it, and likely we do in Iowa. The action part is really about, if you're aware of it, do you have the means to mitigate it, to protect yourself, your family, even
Right.
your pets.
Well, and again, being fairly observant. So we're saying it's not a law. Your look says, it probably should be.
It should be. It should be, because this is of course, no one wants to be in a dwelling with radioactive gas. And as soon as you know about it, it's probably going to haunt you a little bit, because maybe you're a very healthy person and you don't smoke and you do try and take care of yourself. If you're living in an area with radon, you're 10 times more likely to cause lung cancer in people who smoke than those who do not. But it's a second leading cause of lung cancer overall. So it doesn't matter if you smoke or not.
Right. Yeah, because I've known some people that didn't smoke that got lung cancer. So very real possibility that
Highly
this was the cause.
suspect.
You talked about mitigators,
Mhm.
and I'm assuming these are companies that can do something about it. Is Is it specifically for radon? Is it part of another service that maybe somebody in the trades or something works with? Who are these companies?
It's pretty much radon mitigation is enhanced ventilation.
Okay.
So, it comes from the soil. So if you have like a typical foundation, the uranium is potentially breaking down in the soil below your foundation, but it's a gas that can seep through any cracks. It'll make its way through. So, um, increasing that ventilation. So, say you don't actively live in your basement, but your basement filters straight up through your home through vents. If you increase some ventilation in the basement, it should reduce that level to a safer level to be exposed to.
It
So,
sounds like probably some certified and licensed HVAC companies, that type of thing
potentially,
could
yep.
potentially be it.
hmm
So do you have that list of people that
Yeah.
are certified to be able to do it?
The Iowa Health and Human Services maintains a radon hotline,
Mhm.
and they also maintain a list of licensed radon mitigators.
Now, before we started, the idea of how did this get here to begin with, I didn't realize what the answer to that was.
It's potentially from glacial deposits before any of us were here.
Wow.
Yep.
Yeah, so this is not something that was
Naturally occurring
man-made or
uranium.
yeah,
Yep.
so it's naturally occurring. So we're not talking about something that, hey, we just need to do a better job of cleaning up the environment. It's here.
hmm
Can't do anything about it.
hmm
Is it? I know that you said across Iowa, uh, nature, animals, everybody else doesn't pay attention to state lines. Nobody else
hmm
cares. So we're right next door to Nebraska. Does it get better if you cross the river?
To my knowledge, it's pretty much in the Midwest. It
Okay.
is a decent issue. I am most familiar with Iowa, of course, lived
Right.
here,
Yeah.
work here, but I do know that it's not specific to our borders.
Right. So that's well, it's just something to keep in mind. I remember in elementary school we had to make these maps with little overlays of where the glaciers
hmm
stopped and that kind of
hmm
thing, and a lot of them stopped in Iowa.
hmm
So and I don't know if you can answer this or not. Is there differences from, say, the northern part of the state to the southern part of the state where they didn't get as much glacial activity, or is that
I'm not
not seeing
entirely
really any
sure.
difference in that?
I'm not entirely sure,
Okay.
but it's definitely possible. And if you think about some of the runoff from different rivers, it's
Hmm.
potential because it's truly a substance in the soil, and then that's what's breaking down. It's not going to be a substantial amount from runoff, but it's possible that it has now spread maybe more than the original deposits due to that runoff or
Well,
other
now I'm
factors.
sufficiently paranoid. So tell me where. So I need to go get the test,
Yep.
right? And do you know how the test works? I mean, how involved do I have to be in what's happening?
Super easy. So you buy the little pack. We use the brand Air Check. That just happens to be what we have purchased. Essentially, you pay the $11, and that includes the prepaid shipping labels. So you're going to do the test. Um, you pretty much seal it back up, send it off to this lab, and then the lab, I believe, has an online portal, or if you do not have online access, there's a number you can call to get your results. And then it's pretty much you set it, leave it, send it, they analyze it, and they report back to you. The action's going to be reaching out to a mitigator if you find out you have a issue.
So is it a long process? I mean, is it going to take a long time
No,
to leave it out and
no,
a
I
long
believe
time to get the
it's
results back?
no, I believe the packs that we have, you leave them for it's 48 or 72 hours.
Okay.
Not long at all. You send it off. I believe it's standard mail time, so we'll give it a few business days, gets to the lab, and then I would say within a week. So no, it's not a super in-depth analysis that they have to do.
Now I know you said the tests are $11. Is it something that you keep in stock? People can just
Mhm.
come by, write you a check, and take one home,
Yes, or cash.
or cash. That will work as well.
Exact cash. We don't have petty cash.
No, no change. Bring $11. That's how it works. But I am well. This is I'm not really sure what to do with this news because it feels like, oh, there's stuff going on here that I wasn't really thinking
It's
about,
probably in
which is
here.
probably the reason why the Board of Supervisors say, look, we need a proclamation here because nobody's thinking about this.
hmm
So it's just been kind of out there. I know people talk about radon. I know I've seen commercials for it,
Hmm.
for whatever it was that they were trying to sell. But it's never really been something that I've given too much concern
It's a
about.
bigger issue in our area than I even ever thought. So,
Yes. So when you
and not
were
just our area,
right,
Iowa.
yeah, just all across the state, did the Board of Supervisors ask you to come in and talk about this? Did you present it to them? How did this get on their radar?
It is definitely a public health topic that we try and bring up just
Hmm.
because we both have the environmental health side
Yeah.
and our public health side. We're trying to focus on some more cancer. As we heard you say earlier, we are like second leading of new incidents of cancer. So, just in general, trying to make any dent that we can. And we know that radon is kind of one of those silent, passive, you're nothing that you are doing
Hmm.
is causing it. So, it's not like we can teach you to drink less alcohol or get some more activity, stop smoking. This is truly like you have to go out of your way to find out about it to protect yourself. So it's more that those other things, people know that those are bad for you. Like you said, not a lot
Yeah.
of people are thinking about radon or know how bad it can be. So um, it ultimately just kind of comes up as something I wouldn't necessarily say every year. It could be every year now, just as we want to bring more awareness to it. But it's just something on our radar that we want to ensure that we brought up for everyone else's radar.
So just go down to Pottawattamie County Health and
Or the planning department in
or
the courthouse.
or the
So
planning
if you
department, the
are in the
courthouse have them. Okay.
courthouse instead, you can go to the planning department. They also have them for sale.
All right. So get that done.
Yeah.
Let's get some stuff tested. And listen, I'm a believer that information is never a bad thing, even when it is bad information.
Mm-hmm.
If it's bad news, it's better to know it
True.
than to just kind of walk around with dark
Mm-hmm.
sunglasses on and not paying any attention to what's going on. Well, listen, thank you for coming in and talking about this. Thank you for what it is that you do. You have one of those jobs that you probably don't get a spotlight shown on you very much, but we are grateful that you're doing it. And congratulations on the start part-time, and now suddenly look at me,
Yeah.
I've got the department now, we're going to go. So
Yep.
congratulations on that.
Thank you.
And again, thank you so much for coming in.
Yeah. Thank you so much.
When you're ready to buy or sell a home in the area, turn to Blake Hunter, your trusted realtor with Berkshire Hathaway Home Services. Blake knows the local market and is dedicated to helping you find the perfect place to call home. And he also is the host of a popular podcast called Hunting Home. So he's been on hiatus with that for a little while, but we're going to get it going again really soon. And he shares insights, tips, and the latest trends in real estate. So whether you're a first-time buyer upgrading or ready to sell, Blake Hunter is here to guide you every step of the way. Visit his website, blakehunter.homes. And when you're in the market for stylish, locally curated fashion that's close to home, Unique Boutique Iowa is in Neola on 101 4th Street. Stop in and see Jamie for trendy clothing, accessories, and distinctive gifts. You're going to get homegrown passion and quality and community to every piece. Open Saturdays 10 to 2, Sundays 11 to 3, always online at shopubiowa.com. Thank you again, Candy Steenblock, for joining us today. Great information. I learned a lot, and I do hope that you come back and see us again. My name's Todd Studer. We'll see you back here tomorrow morning.